Hi there. This video is going to be telling you all about tetraplegia and paraplegia. These two terms are both classifications for different types of paralysis. The cause of paralysis is spinal cord damage, and there can be incomplete and complete paralysis. These will be discussed later. Paraplegia is classified as any spinal cord injury below the T1 vertebra, causing paralysis in the lower extremities. Patients with paralysis will have full use of their upper extremities and may have full control of their trunk movement. Tetraplegia is classified as any spinal cord injury within the cervical spine and will commonly affect all four limbs. This can be a life-threatening condition if it affects the patient's ability to breathe. Causes of traumatic spinal cord injuries include motor vehicle accidents, falls, and sports-related injuries. Some signs and symptoms of spinal cord injury include the lack of sensation or movement in a limb, difficulty or inability to breathe, bowel or bladder dysfunction, and something called spinal shock, which is when limbs temporarily do not have their reflexes. After the acute management of a spinal cord injury, an MRI will be taken of the spine. This image will assess the level and amount of damage in the spinal cord, and also will be able to predict the amount of impairment in this patient. With an acute spinal injury, the primary goal is to reduce the amount of swelling within the spinal cord. Surgery may also be possible if there are any structures within the spinal cord causing damage. Rehabilitation of a spinal cord injury will depend on where the location of injury is in the spine. Also, the amount of functionality the patient has will greatly dictate the long-term prognosis for their injury. There are other non-traumatic causes of paralysis, some of which include stroke, ALS, Parkinson's disease, spina bifida, polio, and other infectious diseases. The American Spinal Injury Association grades paralysis on a 5-point scale, ranging from complete paralysis to various forms of incomplete paralysis. Anybody is at risk to sustain a traumatic spinal cord injury. However, men have been shown to be at greater risk because they are more likely to take risks. Motor vehicle accidents account for the greatest majority of spinal cord injury. As a quick summary, tetraplegia and quadriplegia are both forms of paralysis that can be caused by trauma or non-traumatic medical conditions and can affect you or somebody that you know.
Created using Powtoon.